Cherry Health does an amazing job of taking care of some of the most disadvantaged kids in our community. But it's not just a come in to Cherry Health when you're sick. You can get your dental health there, you can get your WIC certification, you can get education done, you get your well child visits, you get your sick visits.
Helen DeVos Children's Hospital provides the next level of care, whether it's emergent care, surgical care, or subspecialty care.
One of my roles is to see children that have the most complex health needs, and they also often have the most complex dental needs or the highest level of dental needs. Previously, our patients, those with Medicaid or that had no insurance, would have to go out of town, often to Ann Arbor or to Lansing, to receive treatment under general anesthesia in the OR. Now that Cherry Health is able to see them and we can go to the OR at Helen DeVos, patients can stay right here in the Grand Rapids area, which is really important to that population in particular because they often have the greatest barriers to care.
To think about, I can give the kids breakfast or lunch, but I can't give them both today, is painful reality for a lot of families.
Cherry Health and Helen DeVos have always had a relationship with each other that we know that when we send our patients there, they're going to get excellent care, they're going to be treated with respect.
If the physician caring for that baby says, I'm worried about your child, but I'm not exactly sure where we need to go next with this, let me call my subspecialist friend at the Children's Hospital and get some direction on this for you.
And usually within less than 5 minutes, that specialist is on the phone with me and I can just run the case by them really quick.
All at the same time while the older child's getting her shots that day or the mom's getting a WIC appointment.
We now have our newborn services that will help see those patients, get all the testing, immunizations done, and then have the follow-up happen at Cherry Health, so that the physicians at Cherry Health can spend the time seeing the patients in their clinics and not need to come over and do the care here.
The transition between our clinic and Helen DeVos is seamless. The patients sometimes don't even know that we're not the same organization. That allows us to treat all of the dental needs at once so they don't have to return for multiple appointments. But again, it's also the safest way to treat a lot of our patients.
Open access is a concept that would dictate that no matter who you are and no matter what kind of social class you come from, you will have access to the care that you need. Because we're a federally qualified health center, we have to do that. Helen DeVos Children's Hospital does not have to do that. However, they do. It's one of those things that you probably take for granted until you've got a child with special needs and they need special care and you're turned away because you don't have the right type of insurance.
DeVos Hospital for Kids is amazing. I mean, they're geared to deal with children. I walk in the door and Cherry Health has already called ahead and said I'm coming. I don't have to stand there with a crying baby or our child that's nervous and afraid and in pain or sick.
We can say with pride in our community that we are doing the best job possible with our most vulnerable population. And if that's not the mission of a children's hospital, in partnership with community organizations, I don't know what is.
One of the things that we clearly need to do is realize that Cherry Health can't do all this on their own. Helen DeVos Children's Hospital cannot do this all on their own. And so we really need to continue to work on these collaborations, work together to take care of the children of our community. This is a growing, vibrant community, and to do that, we got to do it together.